If is used, let's recall the steps how to give the lateral glide to the tennis elbow patients and how you can see the improvement within seconds. So before giving the malignant glide, you will ask your patient to pronate the forearm and you will give a dynamometer, or you can use a soft towel and you will ask your patient to grab it or grip the soft towel, and you will see it will be very weak. Now you will have to stand just at the side of patient or the side of area that you want to treat, and the malignant belt will be going like this, like a seat belt onto the therapist side, and then you will cover the entire forearm, the radius and ulna, like this in this image. Now before applying the glide, first of all, you will stabilize the joint from proximally and distally, as you can see in this image, and then you will ask your patient not to grip or use the dynamometer while I'm applying the glide. Now how the glide will be given, just extend your spine and a very beautiful glide, lateral glide will be applied to the elbow joint, and then sustain the glide to the end range. Now you ask your patient, is it pain free? Okay, if the patient says yes, it is pain free, then you have to ask your patient to use the dynamometer or use the gripping kind of activity with the towel, and you will see it will be improved. Now if the patient says it is painful, then you just slightly change your angle of the belt, or you can use slightly more distal or proximal. Okay, until and unless you have achieved the pain-free mobilization. Now once you have achieved the perfect angle which is pain-free, then you have to repeat it for 6 to 10 repetitions. If you don't have malignant belt with you, then you can use this manual technique or manual method to apply the lateral glide, in which you have to use the web space of your thumb and the index finger like this and stabilize the distal humerus, and the applied glide will be in this direction. Now if these two methods are not working for you, then you can use this fourth image method, in which you have to push the radial head and the extensor muscle group towards the inner side so that you eliminate the muscle action, and you have to sustain the glide, and then you ask the patient to do the gripping kind of activities or use the dynamometer. And if this works for you, then go with this glide and follow Physio Alchemy for more education content like this.